It's taking action tonight. 8 News has obtained access to disturbing new details about an elder abuse case at Colonial Heights Rehabilitation and Nursing Center.
We've covered this case since last December when nearly 20 employees were arrested for their alleged roles leading up to the death of a patient last fall. Well, tonight, 8 News reporter Sierra Krug is taking action and joining us live in studio after combing through search warrants filed last week. And Sierra, you found some disturbing messages.
Deanna, Eric, yes, that's right. While more than a dozen employees facing charges relating to this case appeared in court last Wednesday, prosecutors confirm some of those defendants could be facing additional charges. And tonight we have a first look at new evidence. So I want to break down the key takeaways from these 3 search warrants. Investigators found texts allegedly insulting a patient, calling them garlic smelling, and using an expletive. Also in the text messages, Nurse B seems to admit to not giving patients their medication, saying, quote, "The people that can't talk didn't get expletive." Nurse A responding, saying she does the same thing and that the patients were, quote, "gonna be okay." Text messages also revealed Nurse A removed pills from the medication cart and left them in her personal car for Nurse B to pick up. Through further investigation, residents allegedly would go across the street to sell narcotics. Detectives writing that they possibly brought this money back to facility staff members. And after moving patients who were, quote, beefing, the nurses told one another to lie, writing there were no issues. Seemingly against policy, new evidence also revealing nurses would text the facility's doctor that they had put in orders for patients without the doctor ever actually seeing the patient. That was apparently dependent on whether or not the doctor liked the employee. The warrant also alleges nurses would charge for services that were never provided. One of these nurses is charged with felony abuse of a vulnerable adult resulting in death. Prosecutors dropped their initial misdemeanor charge against the other nurse, suggesting they would be coming back with more serious charges in light of this new information.